what is the difference between osteopenia, osteoporosis, and osteomalacia? Well, they're all metabolic bone diseases. But first, let me answer what is osteomalacia, because that's completely separate and a different disorder from osteoporosis and osteopenia. Osteomalacia basically is a metabolic bone disease that is, by definition, due to severe deprivation of vitamin D. In order to have strong bones, you need vitamin D. And when you have osteomalacia as a child, it's called rickets. And a lot of people understand what rickets is, where you have very, very soft bones. People can fracture. They even, in the bone growth, they can have bowing out of the legs because the bone is so soft. As adults, we call it osteomalacia. And if somebody is severely vitamin D deficient, and they aren't aware of it, and they're not taking or replacing vitamin D, which you can get from the sun, but now even with sunscreen, many people don't absorb enough vitamin D, or dark-skinned people don't either. So people need to take vitamin D supplements. So that is true. But really, by definition, is a completely different disorder than osteoporosis and osteopenia or low bone mass. And it just really means bones are very soft, then they're at risk for fractures, and but can be treated and prevented. Osteoporosis and osteopenia are all part of a spectrum of a different type of metabolic bone disease. And many, many years ago, when somebody was diagnosed, we never diagnosed osteopenia. Then, a long time ago, the definition of osteoporosis was we made it when somebody fractured, and they kept having more fractures. Well, in the early 1990s, the World Health Organization got together with a worldwide group of experts in bone, and they decided our goal is to prevent that first fracture. We don't want to make the diagnosis of osteoporosis when somebody falls from standing height. And I'm not talking about traumatic fractures off of a chair, or somebody falls off of a building or off of a ladder. I mean, somebody who trips in the street, somebody who literally gets up, breaks the ribs, somebody coughs and breaks, a bone, people who really were having what we call fragility fractures, and that's how they made the diagnosis. So in the early 1990s, there was a consensus conference to say, let's define this condition now that we have an opportunity to define it based on a bone density test. Some people call it a DEXA machine, and we have been correlating the results of this with one's future risk of fracture, and our goal was to define it prior to that first fracture. So by definition, if your T-score, which is a statistical term comparing that test result to the peak bone mass of a 30-year-old, when people usually reach their peak bone mass as they're growing up, then if it's less than or minus 2.5 standard deviations below that mean T-score, that is the definition of osteoporosis, because that is definitely correlated with increasing risk of fracture. When one gets a report back, and we look by convention at spine and hip on different types of machines, of -1 to -2.5 standard deviations below that mean peak mass of 30 years old, that's a T-score, that is called osteopenia. But many of us in the field like to refer to it as low bone mass. Because when someone gets that report with that osteopenia diagnosis that first time, it doesn't mean that they lost all that bone. It may be that for that individual person, they never reached a peak bone mass of a level that was considered normal range for a healthy 30-year-old. So there's convention now that up to -1 is considered normal compared to a 30-year-old. -1 to -2.5 is considered osteopenia or low bone mass. And lower than -2.5, including -2.5 standard deviations, is considered osteoporotic. And those factors, by the way, that T-score is better correlated with one's future risk of fracture than even the blood pressure with a stroke risk and a lipid panel with heart attack risk, yet many people do not even know their results or what their T-score is. On that same machine, we get something called a Z-score, and that is where we compare people to their age-matched control. But we don't want a 65-year-old woman being normal compared to other 65-year-old women. We would like to make sure that that person's T-score is, not really low compared to that peak bone mass of a 30-year-old. The true definition of osteoporosis beyond the T-scores, it means porous bones. And, a picture is way better than any words. And really imagine that your bones have an outer coating that is quite strong called cortical bone. The inner part is a bony lattice network of minerals and really different kinds. It should be thick and maybe some minerals in between. But when you have osteoporosis, you really have porous bones. The holes get bigger in the inside of the bone, and it lends one to an increased risk of fracture. Even if you roll over in bed or you cough, you might have rib fractures. So it's very important for one to understand that by definition, osteoporosis, just think of porous, thin bones that increases your risk for having a fracture. So those are the differences between all of those definitions. And over time, most people will get a baseline. And then as time goes on, we can see if it's stable or losing and getting lower. And it helps us guide people on bone health management.